Yeah, we miss Harris at Penn. He used to be on the floor above me, but we're glad he's nearby. I'm trained in social work, and as a social science researcher, I have a job in a school of design because I teach GIS mapping. And once I got there, I decided I'd be a social worker at a school of design doing public health research. Which has been a great gig, and I will admit I jumped on this train that many of you got going about built environment and public health, and it's been pretty amazing. And I've seen within the School of Design them make room for public health. So one of our landscape architecture faculty is here, Karen McCloskey, and I mean just that we have somebody here studying play. Maybe you'll get to talk with her and some of her students is really exciting. And I teach a class. I first convinced my chair to let me teach a class with two colleagues in the School of Medicine on health and geography, and then we have our own course now in the School of Design on public health and built environment. So it's really exciting. One of the challenges I think for particularly for city planning, maybe less for public health, is finding room in the conversation for the very basic topics of poverty and race and racism. So we heard about equity, we heard about social determinants of health. If you are familiar with that public health impact pyramid and sort of working our way down to have big population impact, that affecting the built environment is critical. But even more foundational is making some kind of changes in socioeconomic factors and the kind of inequality that we have. I don't have much hope that that's going to happen in our upcoming presidential election. And I don't know, it's a hard conversation. It's a really difficult to do. As a teacher, I think the only thing I can think of is to get our students talking about this, studying this, never forgetting that all of this will be for naught. As if Harris said, we end up making playgrounds for millennials, and bike share isn't for everyone. And I think that we have such a racially and economically segregated country that all these great efforts would be for naught if we aren't bringing everybody along and focusing on full participation. Another critique I would just have of planning and the design professions that again may not be as true for public health is just who are the professionals who we are training, who's the next generation. So researchers are one thing, and we know some of our pipeline challenges as academics, but in city planning and architecture and landscape architecture and historic preservation, we have very low proportion of students of color. And these are the folks who are framing the debate, who are designing the cities. I don't have a great solution for how we figure that out, but it's something that we have to do. It's just not sustainable to have predominantly white professions planning for cities. And I think we need to figure out ways to, if that's changing public education at the high school level or internships or what we do, to introducing the design professions and really showing that they're compelling and important, and that we need to change what they look like. One other, I loved the Plan, Do, Check, Act cycle that you introduced us to in terms of, and Daniel talked a lot about implementation. A lot of us in this room are researchers who have the indulgence of spending a year or two studying something carefully and talking about reliability and validity and causal inference and stuff that we should be thinking about. But on the ground, somebody like Keith, who'll speak next, like city governments, nonprofits, they need answers right away. They need to know right away, how are people experiencing public space, these spaces, these programs, and how can they make them better? And then in the meantime, we can spend our years and hopefully our millions of dollars like figuring out exactly why and why environments are impacting individuals differently. But I think this is a responsibility that we all have, the researchers in the room, to help find ways that our methods can be useful on the ground in public health departments. So I know that Yvonne Michael worked with some folks in the city in a nonprofit doing walkability assessments. And that's something that I'm going to hope to borrow with some of my students and do some work with a focus on an age-friendly West Philadelphia initiative. I think there's a lot of examples of this. Health impact assessments is one tool that came in and said, hey, you don't have to have a 10-year primary data collection endeavor to figure out what's going on to try to make a change. But that's not easy. It's not easy to train folks who maybe have master's level to do research. But I think it's there's a lot of interest and willingness. And just to end on the question of outcomes, I have certainly shared in the frustration of obesity being sort of paramount, even though I've, like I said, sort of ridden this train and did not respond to the open comments about from NIH. But I really like this idea, and this is for all of us, public officials, researchers, to reframe, really what the end game is. And one thing I would put out, certainly in social work, social welfare, well-being, I think is a really important concept. I think full participation. And something I've become interested in these public spaces, which we have so many new ones in Philadelphia. I hope that those of you who aren't from here are getting out to see some of our new public spaces, is thinking about who's using them and who's using them together. And I've become really intrigued. We have this diversifying, white will be the minority within 30 years in this country. Are the spaces we're building going to be places where people are going to come together across race and class? And that's something that we can sort of study and figure out, and that has so many benefits in terms of democratic participation, but also health, as we think about racism and racial segregation as being really contributing significantly to health inequalities. Thanks.